Welcome, everyone. We should be live now. Welcome to the Truth About Liver Cancer Caregivers Corner. We are so excited to have you today. So let me start by introducing myself. My name is Andrea Wilson Woods, and I am the president and founder of Blue Fairy, the Adrian Wilson Liver Cancer Association. And today's workshop, The Truth About Liver Cancer, is produced by Blue Fairy. Blue Fairy is a nonprofit organization, and our mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, also known as HCC, so you may hear that term today, through research, education, and advocacy. Now, it was never my life's dream to start a nonprofit, not at all. However, when I was 22 years old, I was living in Los Angeles, and I gained custody of my 8-year-old sister, Adrienne. I raised Adrienne all through my 20s until she was diagnosed with stage 4 hepatocellular carcinoma, HCC, 1 month after her 15th birthday. Adrienne lived 147 days with that diagnosis, and for context, she died 2 months after my 29th birthday, and it absolutely changed the course of my life. A year and a half later is when I founded Blue Fairy, because I didn't want other liver cancer patients and caregivers to go through what we went through. I wanted to make sure that they had support and hope and a voice. And that's what we're doing with today's workshop, is we are giving people a voice. Today, you're going to meet the caregivers of liver cancer patients. They're going to share their experiences about how liver cancer has impacted their lives and their loved ones. And I know their stories will fill you with hope and inspire you to take action. Now, before we bring our first panelist to the stage, I want to talk a little bit about Zoom webinars because it's a little different than your typical Zoom meeting. We have a lot of interactive features. First of all, we highly encourage you to engage in the chat. So Allison, who is our co-host and program manager, she will be monitoring the chat. So Allison, if you could please say hello to everybody who's here live in the chat right now, I would greatly appreciate it. So we really encourage that interactivity in the chat. Love to see it. However, if you have a question, please put that in the Q&A. So you should see a toolbar. By the way, if you don't see the toolbar, take your mouse, kind of gloss it over the screen, and the toolbar will pop up. Sometimes it's floating in Zoom. And you'll see a little question mark for Q&A. Please feel free to ask any question you like. You can ask it anonymously if you choose to do so. And if you see a question that you find interesting, you can upvote it. And what we will do at the top of the hour, perhaps a bit sooner, is we will go through and answer all of the questions that you have. So again, chat, engage in the comments. I see people here, but if you have a question, put it in the Q&A, and I promise you that we will get to it toward the end of our live workshop today. Another thing that Allison's going to put in the chat for you right now is our patient community. Blue Fairy has a private liver cancer community specifically for HCC patients and caregivers. And it's a private online HIPAA compliant forum. Really, really critical. So it is HIPAA compliant. Your health information is safe there. So we encourage you to learn more about our patient community. And again, Allison's going to put that link in the chat several times throughout the workshop so you don't miss it. Now, I'm very, very excited to bring our first panelist to the stage. Allison, if you could please bring Betsy Villiotti to the stage. And I may have butchered Betsy's last name. I've been practicing. Let me tell you a little bit about her. Betsy is the vice president and co-founder of NASH Knowledge. She is also the organizer and administrator for NASH Knowledge's Liver Support Group. Betsy brings the important caregiver perspective as she quickly became her husband Tony's caregiver during his liver disease and cancer journey. And we actually had Tony participate in a previous The Truth About Liver Cancer workshop, and you can see that on our YouTube channel. Now, Betsy is a graduate of Slippery Rock University and earned her master's in education from Lock Haven University. She is a retired school teacher. Thank you for your service, Betsy. And she still occasionally serves as a substitute teacher. God bless you for doing that. She also volunteers for the Center for Organ Recovery and Education, also known as CORE. So Allison's going to put in the chat for people a link to NASH Knowledge. Allison, if you'll do that while Betsy and I chat. As well, if you could put a link for the Center for Organ Recovery and Education, CORE, because that sounds really intriguing. Betsy, thank you so much for joining us.
I'm very, very happy to be here. Thank you for having me.
Oh, I'm so thrilled you're here. And I know the story from Tony's perspective, but the caregiver perspective, of course, is very near and dear to my heart. And also, it's a different story. So I want to start out with, when was Tony, your husband, first diagnosed with liver cancer?
The first time Tony was diagnosed with liver cancer was in the fall of 2015. And they said to us, okay, we're just going to monitor it and see how aggressive it becomes. And then we'll decide on the treatment. So 6 months later, they tell me, oh, I don't know what happened. There's no cancer. So we're like, oh, woohoo, no cancer. And he was turning 70 that year. And I said, we're going to have the biggest, best 70th birthday party you can have. And we were monitored every like 3 months or so. And then in the winter of 2017, he has his MRI, and they asked us, can you come in early for your appointment? And when a doctor asks you to come in early for an appointment, you know something's not right. So yes, we went in early, and we had this sneaking suspicion he was definitely had liver cancer at that point in time. And it was actually St. Patrick's Day when he was diagnosed.
Wow. So not that you would forget that day, but having it tied to an exact holiday, you're never going to forget. I always find it fascinating when I talk to patients versus caregivers, because patients don't always remember that day they got that diagnosis, but caregivers always remember. They always remember that day. So I want to, before I ask more questions, I want to ask what happened with the 70th birthday party.
Oh, it was great. All his family, his friends, his mother came, who was 96. And it was really strange because all his family came, and they got to see his 96-year-old mother. And sadly, she passed away that Thanksgiving. But, you know, everyone was like so thrilled that I had the party so they could all connect again. So, I mean, it was sad. But on the other hand, everyone was pleased that they got to meet him, and Tony had a great time.
So when your family and friends came to Tony's party, at that time, you thought he was cancer-free. Is that correct?
Absolutely. Yes. Yes.
So during that second diagnosis, what did your family and friends think of all of it?
They were very supportive, the family and friends. They thought, Tony, he has cirrhosis, he has cancer, he's probably doesn't have much time left. But then again, part of his family, like when he had been visiting his mother and had been falling asleep, they didn't realize that the cirrhosis was causing some of that. So even though he was feeling well, he could fake it pretty good. But like if he was sitting alone with someone, he would like drift off and not really be as engaged as he normally could. And I think some people wonder, what's wrong with him? I don't know. But for the most part, everyone was very, very supportive.
So for the people who are watching live and watching this later, would you, and we preface this by saying, I meant to say this at the beginning, we are not medical professionals, but we've been through this as caregivers. Would you say that fatigue might have been one of those early signs?
Oh, absolutely. Even before he was diagnosed with cirrhosis, we knew, like, he would always be tired. He goes, well, I'm old. That's why I'm tired. I'm old. And then once he had the cirrhosis diagnosis, we started putting things together. But we were very naive. When symptoms came up, we didn't know that that was a symptom at first. So symptoms would come up and would just be, oh, you must be sick, or that, we thought a lot of times he was dehydrated. So
Can you, would you give us another symptom that would be unexpected that people might blow off? For example, one of my sister's only symptoms, now mind you, she was 15 years old, but she had a lot of heartburn, a lot of indigestion, and she was eating Tums like they were Tic Tacs or something. And it was one of those things as a parent at the time, I was like, well, I can control what she eats in the house, but I can't control what she eats when she goes out with her friends or at school. So my attitude was like, just eat fewer tacos, but she had this really severe heartburn. So did Tony have, I know we're going to get into the HE and explain what that is, but did he have any other symptoms that people just might not have known that were related?
he had like a lot of nosebleeds.
Really?
Yes, he had a lot of nosebleeds that were uncontrollable at times.
Wow.
Yeah, yeah. And he had a lot of bruising. Like if he'd bump his arm, it would bruise a lot. And sometimes he would trip and fall a little. And we didn't realize that muscle waning is all part of this. So as his muscles
Wow.
were waning, he would like maybe trip, and he would always tell me, your suitcase is so heavy. And I hadn't packed anything more than I ever did before. He didn't realize that he was losing muscle mass, but I did way before he did.
Oh my goodness. Wow. So I see something popped up in the chat. Please definitely make sure to put that in the Q&A, and we will answer all those questions at the top of the hour. Again, with the disclaimer, we're coming at this from the caregiver perspective, not a medical health professional necessarily. So Betsy, throughout Tony's treatment journey, what were some of the challenges that you faced as a caregiver?
Um, some of the challenges that I had faced were he would be confused a lot, and that's where the HE came in. And I never had heard of the term HE, hepatic encephalopathy. And what that is when your liver cannot get rid of all the toxins itself, then the toxins build up and they go into the bloodstream, and then it goes up to the brain.
That's
And for
right.
lack of another word, I would just say he was acting a little crazy. And
I don't mean to laugh.
no, that's true. You can laugh all you want because now it's over and we can laugh. But
But everyone with HE says that. They say that they either didn't realize how bad it was or they felt like they were kind of going crazy.
yeah, well, he didn't know, and I didn't know. And the most times that this happened would be on vacation when he was eating poorly and having a little too
Oh,
much sugar and things like that. So I would blame it all the time on dehydration. And I'd say, drink more water. I drink water. No, 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 you drink, you're at the beach. And so yeah, that would be our little discussion, if you will, uh, with the water. And then one day we were coming home, we were getting our snacks ready for the car to go home the next morning, and we were driving on the highway. He was all over the road. I really was like
oh no.
really scared of what could happen. And I said, pull over, get me out, get me out. If you want to kill yourself, go ahead. I'm getting out. And finally he gets to the gas station, and I went in to get snacks, and he was going to get, and I'm thinking, how am I going to tell this guy he's not driving again? And he was getting the gas. Well, when I came out of the gas station, he said to me, there's something wrong. The pump's not working. And I said,
Oh,
let me see. And there was nothing wrong. He just couldn't figure out how to pump gas. So,
wow.
oh yeah. So he looked at me, and he gave me the keys. But still, even at this time, because we had never heard of hepatic encephalopathy, I thought it was all caused by dehydration, because confusion is often a symptom with dehydration as well. So, Tony and I were very naive with a lot of the symptoms. So that was one challenge. And then when he did have his HE, I had to wonder, like, now is he just trying to be a jerk? Or is it, because there were so many things that were not like him.
Can you give us another example where that's something that was not like him?
Well, when I would try to get him to go to the hospital, I said, Tony, you need to get to the hospital. You're not yourself. And
right.
He would get a little belligerent with me, which is totally, if you know my husband, it's totally, he never even raises his voice usually at me. And I had to threaten him that I wasn't going to be back when he came if I was leaving the house. And I didn't know when I would come back unless he got in that car to go to the hospital. And, reluctantly he went. And it wasn't just me doing this. I called the hospital, his doctor, and said, these are the symptoms. And they said, get into the hospital right away. And he still didn't want to do that.
When was he, and thank you so much for explaining HE so well. When was he diagnosed with HE? I mean, when did the doctors finally say, this is what's going on?
Well, we were at home, and he had the first time he had to be rushed to the hospital. I didn't even know. I came home and he was standing there like trying to walk through a wall. He didn't know who I was, where he was, or what was going on. So again, I called, and again, I'm trying to push water on him. You're dehydrated. Drink water.
He's like, I've had so much water, I can't.
Well, he didn't know. He didn't know anything. Like I said, he was trying to walk through a wall, I think. And finally, we got the ambulance to come, and they took him to the hospital. And he was like a little kid. Like they said, okay, put your hands like this while we take you down the steps, because they couldn't even get him to walk down the steps. They had to get him.
Wow.
And then get him all together with his hands like that. And as soon as they walked away, he'd go like this. Ha ha ha. He was acting
like a toddler.
He was. It was, and so finally they had to tie his hands. But that was October of 2017, after he had been diagnosed with cancer. So that was October of 2017. And from that point on, he was having more and more bouts of hepatic encephalopathy.
And so I just want to say again, for the people watching live or watching the replay, not every person who's diagnosed with liver cancer experiences HE, but if you see that your loved one, especially if you know they have underlying liver disease or they have that liver cancer diagnosis, if you see anyone having these kind of symptoms that Betsy's describing, where they're just not acting like themselves, being belligerent, not being cooperative, walking into a wall, I mean, just genuinely like seem confused, get them to a hospital right away. Because often HE is not diagnosed until much, much later. Which is, again, not everyone experiences it, but doctors know what it is and see it quite clearly. Betsy, let's talk about you. What types of support did you receive as a caregiver throughout Tony's treatment journey?
My family was supportive enough, but I did all the work. And, I hated to leave him. Once he had that terrible bout of HE, I quit my job as a substitute teacher, and I didn't want to leave him. So sometimes, like, I would talk to my daughter, and not say babysit, but would you want to come over and spend some time with your dad so I can go out with my friends? So, I was retired, Tony was retired, so we didn't really have the need. We didn't have young children, but I always tell everyone, if you're a caregiver and somebody offers help, take it. Don't be, and if they say, well, if there's anything I can do, because they don't know what to do.
Exactly.
tell them like, oh, you know what? Could you please take my kids to basketball practice or whatever it is, they need a direction because when people ask you, they honestly don't know what to do. And there are so many things that little things like, oh, if you're going to the store, could you please get me this or get me that? Because you really don't like with me, I didn't want to leave Tony very often because I
Yeah.
didn't know what would happen.
You and I are so on the same page on this because that's what I say to people is that if you have good friends around you and support, they're going to want to help, but most likely they will have no idea what your needs are. And instead of trying to guess, just tell them, and that's exactly what we did. Like there was one time where I didn't have time to go to the grocery store. I was like, if you can go get X, Y, and Z at the grocery store, I'd really appreciate it. Because I think most people do want to help but they need direction. So I love that you said that because I'm right there with you. Those few times when you did go out and you had someone watching Tony, um, I know that you knew something was wrong via text. Could you tell people what that was?
Well, I would text my husband, and if he would text something legible and that made sense, concise back, I would be okay. I can stay another half hour or an hour. But sometimes his text would come back gibberish. It didn't make any sense. And I knew that I had to hurry up and leave the house because I knew something was wrong and probably another trip to the hospital for his hepatic encephalopathy.
Yeah, wow. Thank you so much for sharing that. What advice do you have for other liver cancer caregivers?
Um, Take care of yourself. If
Hmm.
you can't take care of yourself, then you're not going to be good to anyone else. I know I didn't take care of myself. I didn't go to the doctors. I didn't eat right. I didn't do what I should do. And after Tony had his transplant, I had 9 doctor's appointments that I had to go because I just didn't. I canceled them all. So
Yeah.
that's the other thing. And take care of yourself physically, but also take care of yourself emotionally. If you have a friend you want to talk to, because this is such a heavy burden. And they're really like when I was doing this, there was no one who knew about it, no one who understood it. I felt so alone. And then I'd Google, and that would just scare me to death because, don't Google. That's another don't Google.
No Dr. Google for you?
No, no Dr. Google. But like everyone say, how's Tony doing? No one said, how are you doing? And,
I,
and
yeah.
and I wasn't doing well. And I didn't think to talk to a therapist. But if
Mm,
you are a caregiver and it gets over and it can get very overwhelming, then do telehealth. If you don't want to leave your loved one, do telehealth and talk to a therapist so that you can get that support that you need. I mean, your family tries, but unless they're actually going through it, they really, really don't understand. And that's
yeah.
why, if I can just say this, in my
Yeah, please.
NASH knowledge, we have a support group for people with liver disease. So if anyone's listening and they want to join a support group, we do it by Zoom. So we have people from coast to coast. And I just thought maybe I'd throw that in.
Yes, no, please. So, Allison, if you'll make sure again, if you just put in the chat again, put the NASH knowledge link. One of the funky things about Zoom, so people know that when you join, if anything was in the chat previously, typically you cannot see it. And so that's why we're going to continue to put things in the chat more than one time. So Allison, please put in NASH knowledge. And also, to your point, we have our private liver cancer community. So Allison will also put in links to that and learn more about it. But I really love that you said take care of yourself because I know that when people ask me what I did, like I didn't do that at all. Like I did not take care of myself. And so I really appreciate you sharing that. So if you have any questions for Betsy, she is still here. We'll be answering questions at the top of the hour. So Allison, right now, if you could put Betsy sort of backstage, if you will. And Betsy, thank you so much. And we are going to bring Allison Davis up to the stage and hear another caregiver story. And I'm so sorry I said Allison because Allison's our program manager. A lot of A's going on. Everybody, I want you to meet Angela Davis, as you can clearly see from her name. Angela is from Huntsville, Alabama, which is right up the road from where I am right now in Birmingham. Angela cared for her husband, Russ, who was diagnosed with liver cancer in August of 2022. He passed away 18 days after his diagnosis. Angela had been a dental hygienist for 27 years. In her free time, she likes to spend time with her daughters and family, as well as read, scrapbook, and camp. And Angela, I forgot to mention this in our practice pre-call. I'm with you on the reading and scrapbooking, cannot go there with you on the camping. Cannot go there. Not even glamping, can't do it. So Angela, this was very recent for you.
Yes.
When was your husband diagnosed again? And walk us through that, because I'm so sorry. 18 days is not even a month.
Incredibly fast.
It's very fast. So take us back to that time.
So it was August 7th. It was a Sunday. He was having stomach pain, and he finally decided to go to the emergency room. And that is when we got his stage 4 cancer diagnosis. It was surprised us. We knew he had non-alcoholic fatty liver disease, which had turned to cirrhosis, which had been monitored up, to COVID. They canceled an appointment with the specialist, and it just never got rescheduled, even with my trying.
So take us back to that. So you said he was being monitored. So the medical terminology, they always have to have special medical terms. He was under surveillance. So if you do have fatty liver disease or any underlying liver disease, that is what they do. They watch it. Can you tell people, since he knew he had had it for quite some time, what does that actually mean, watching it? So what kind of tests did he have done, and how often?
He would have blood work done every year. He would have an MRI with contrast dyes done every year to see the liver function and, what was going on. His MELD score never got high enough to be put on a transplant list or anything. So they just kept every year, recheck. And then COVID hit, the appointment was canceled. He had said they would reschedule it and let him know when. And after a while, I started saying, you need to get this appointment, but he just didn't.
Do you remember when the appointment was supposed to be?
It was supposed to have been in April of 2022. They hit during COVID.
2 years later? They were still doing that?
Because he wouldn't turn around. He never told me or let me see the letter they had sent. So he just says, oh, they'll let me know when the next appointment is, so like even a couple months later, as things were opening back up, I kept telling him, you need to call. No, they'll call me, or they'll send me a letter. And I said, no, you need to call.
Yeah.
I called for him because of his job, that I didn't know his work schedule with testing. He worked in the GMD program. And so I never knew. So I feel like sometimes I do have the feeling that maybe we could have caught it faster, but doctors had said it may not have been there even 4 months before we caught it.
Right. Wow. When he was diagnosed with liver cancer, how did you feel? How did your family and friends feel?
We were in shock because, like, even the Friday before, he had been out cutting the yard, mowing the yard, doing all the normal stuff, playing badminton with our daughter. I mean, he looked and acted fine. He just, like I say, he just had real bad stomach pain. He said he couldn't get, and he'd had hiccups that night before that he couldn't get rid of. And he finally said, take me to the emergency room. I mean,
Did, did he go for the pain or for the hiccups?
for the pain, the hiccups
For
had
the
stopped, but
the pain.
the hiccups were part of it, we found, because I'm trying to remember how they explained it, but it was, with all the varices
Hmm.
and stuff, so that was causing a lot of the hiccups, which we had no idea. He'd also had a cough all of July that he had gone to the family doctor for, but they couldn't seem to get it, and they had told him if the last treatment of antibiotics didn't work, they would send him to the ENT, which we never made it to. The coughing was probably, again, due to the varices that go along with liver disease and the HCC and all of that.
Wow. So he was admitted to the hospital right away. Is that correct?
Yes.
What happened when he was first admitted? I believe you mentioned it was on a Monday, in our pre-call. What was going on? And because this was so fast, if you wouldn't mind kind of giving us an overview of what that first week was like.
Gosh, it was crazy. He got admitted on Monday. We were waiting for doctors, and then they were coming in. They were taking blood work. They were running batteries of tests. Tuesdays, they had taken him in for more testing, some things where they had to put him to sleep to test and do things. I mean, it was just constant testing. I was also trying, to manage to still continue working because he had been out of work unexpectedly. And so we had to pay bills. I had to be able to take care of our daughter. She was 10 at the time, was in school. So it was a juggle. I wanted to be there. So a lot of times, if I wasn't at the hospital, he would call me when the doctors came in the room. I'd get on speaker. I had a notebook where I was taking constant notes because so much was coming so fast. We were going to try this medicine. We're going to do this. They'd call in the middle of the night. He's unresponsive. We need to go do a brain scan to see what's going on. I mean, it was coming fast. It was really hitting fast. They had put him on morphine for pain, and it was just too much. Took several days. That was what caused his unresponsiveness. He did have some of the hepatic encephalitis. He'd tell me things like, "Oh, you need to get the door. Somebody's there. Maybe we're in the hospital." Nobody
Oh,
here that I
wow.
need to greet. He'd tell me I need to go check the stuff on the stove. Maybe we're we're in a hospital. There's no stove. Like the encephalitis was, tough. And then they do treatments for that. And it was a lot. It was fast, and then we got the chemo drug, but he only got 6 doses, nothing to really help.
Right,
And
right. And had it spread beyond the liver at this point?
yes, it was he had a little bit in the heart, a marble sized piece that you could see on the EKG when they would come in to check that. You could just see it floating in there. They were really worried if that broke off or moved. They had also worried if he had quit breathing, about doing CPR, because that would obviously dislodge it and crush it and send it all over the place. He also had a small piece down in the lower lobe of the left lung.
Wow. Oh my God, I'm so sorry. One of the things we mentioned at the top was your daughter. How old was your daughter at this time?
She was 10.
That's really young,
Yes.
right?
Yes.
We're going to come back to that, specifically your daughter and the support you were able to get for her. How were you supported during this time as a caregiver?
The people I work with, my boss, she was great. They were checking. My church community was really good. We have a special needs group that we work with specifically, and several of them came in. They would be bringing food. They would be checking. If I was at work, they would show up with food because they said, "I knew you probably didn't stop and get anything to eat." They were constantly my daughter's Girl Scout. So a lot of those leaders that help us stepped up and said, "Hey, what can we do? Can we watch her while you're at the hospital? Can we, what can we, so they stepped in to help make sure she was fed and taken care of and homework done. And
That's
it
so
takes a
nice.
community. It takes a village.
It does. It does. Um, Did your daughter have a sense of how serious things were?
I don't know right away if she knew how serious it was. She went that first Monday he had admitted and saw him, and then she wouldn't go back after until the day he was passing away, and we pulled her back in. We had been discussing how to tell her, my husband and I. He didn't want me to tell her he had cancer. I said, we have to tell her. So a nurse that was in there with us when we were talking, that was checking some of his vitals and other stuff and giving medicine, said, we have child life specialists here at the hospital that can come in and help y'all with these things. Would y'all like me to get in touch with them? I said, absolutely. So they had brought them in, and he was still adamant about no cancer. I says, no, we need to tell her the truth. So they helped us decide. We would just tell her at the time that daddy's liver is very, very sick, and that the doctor's trying to find the right medicines and see how they work before they send him home. I did get a call I had let her school know what was going on, that things were
Smart.
not at home, if she's acting different. And she had told her speech therapist that her daddy had liver cancer, even though we had not said it.
Really?
So she figured it out.
Wow, I just got chills.
And they
Wow.
called me and told me, I just want you to know, she told us he has liver cancer. It's like, because we had let them know what we had said so that they didn't say anything different.
Right.
And so
How do you think she figured it out?
she's a pretty smart kid, and she likes to research things. So she probably got online and started researching.
Did
sick
she
liver.
Dr. Google maybe?
Probably, and she wouldn't tell me that, but
Right.
probably what she did, I'm guessing. And so I had to sit down and talk with her on that and say, yes, daddy does have liver cancer. The doctors are working on it. We're really trying to get him to be able to come home. I said, do you want to go see daddy at the hospital? No. Would you like to call daddy? No. I did make her a couple times FaceTime with him because it would help his spirits. And that's what I would tell her. I said, it would make daddy feel better if you would get on the phone and smile at him, or that she just still had that. I didn't want her not to have memory. I was in the spot of, well, what's going on? How long do we have? Because we still didn't have those answers,
Right.
Right.
Did you ask that question? I'm curious. And
Did finally get where like probably about a week and a half of him being at the hospital, I was able to get the doctor aside outside of the room because I didn't want to discourage him. And I said, I have to kind of have an idea so I know what I'm working with. I said, I know you don't know. I know we're still in the diagnosis phase and stuff. I said, she said, well, I'm hoping for 6 months to a year.
wow.
So
Wow. And I don't want to put words in your mouth. When you heard 6 months to a year, and then it was 18 days, what did you think?
I just couldn't, I mean, I don't know if I remember what I thought. It just, because it happened so quickly. I mean, I thought we were here, and then, I was at work that morning, and the normal doctor office call, where he would call and say, the doctor's in the room, and he speakers so that I can hear and they can hear. And then they called later and they said, I think you need to come. Things are not looking good. We're not sure he's going to make it to the weekend.
Did you know what that meant?
Yes, I did.
Yeah.
I knew that was it. And so I let my boss know they're letting me leave. Being an dental hygienist, you have a schedule full of patients. They said, go, we'll handle it. I'm calling my dad as I'm walking out the door. I said, Daddy, you've got to go get my older daughter Paige from school. She was 4 hours away at Troy University. I didn't want her trying to drive home to see her stepdad, but I knew she'd want to be there. So my dad took off to go get her. I'm calling one of her good friends saying, hey, I'm about to call Paige with some really bad news. I know she's probably going to call you first. Can you get to her?
Oh God, that was so smart of you. Oh.
I called the older one. I said, hey, I got tell you, granddad's on the way. They don't think Russ is going to make it. We need you to come home, but granddad's on the way. Well, I'll just drive. I said, no, you're not driving with this. Granddad's
That,
coming to get you. So
that was so smart of you. Really, it was. I remember when my sister was first diagnosed and she wanted me to call her very best friend, but they didn't go to the same high school. So her friend didn't know that she had been out of school for so many days and she had never missed school, so that, all the other kids knew, but her very best friend was in a different high school system. And I kept trying to call her best friend, who was also 15, and getting hung up on. And because she was staying with her dad, who's Russian, and I didn't speak Russian. So I was like, oh gosh. And I didn't know her dad, but I knew her mom really well. And so it wasn't, I think, until a week that we had been in the hospital and she was back at her mom's that week. And I called and she picked up the phone. And I immediately said, is your mom there? And she said, why? What's going on? And she was also shocked that I called instead of Adrian. I said, sweetie, I really need your mom to get on the phone with you right now. And it was just so heart-wrenching because I could hear the wail in her voice, and I can still hear it when I told her what was going on. But the next day, she and her mom were at the hospital visiting, like the very next day they were there. I want to give a shout out quickly to Bonnie Pickard. Bonnie participated in this program last year in our first Caregivers Corner, and I think it was our very first The Truth About Liver Cancer workshop. Bonnie also has spoken at HCC Live, and she referred us to you. So how do you know Bonnie?
through our life group from church. So it's a ladies' life group, and that's how I met her. And this group a lot of them are older than I am, which I absolutely love. And when I was introducing myself, another lady in there that I had known and knew what had happened. And Bonnie came and said something to me, hey, my husband passed away of the same thing. If you need anything, she's been good support.
Yeah, she's amazing. She's such a sweetheart.
Yeah.
I love to tease her about pickleball, by the way. Angela, before we say temporarily goodbye to you, what advice do you have for other liver cancer caregivers?
Like Betsy said, you've got to care for yourself. You've got to be willing to ask for help, accept the help, because you can't take care of your person without the extra support. And don't Google. And yes, absolutely agree with what Betsy said.
Is there one example that you can share before we bring Elisa up of taking care of yourself?
Yes, I did not do much of anything for me. I was just surviving. And then even after that first year, I was just in survival mode, trying to make sure my daughter was okay. Because that's a major thing for kids, to lose a parent.
Yeah.
And I have finally started counseling myself, and counseling has been a tremendous help. I would absolutely recommend get a counselor, because it's a lot to process on your own.
Yeah. Oh, I think that's wonderful advice. So Angela's going to stick around with us. She's going to temporarily leave the stage. And remember, please, if you have questions, put them in the Q&A. And we are going to bring Elisa up. Elisa Herr is from Newark, New Jersey, and she cared for her husband, Ed, when he was diagnosed with liver cancer in July 2019. During his cancer journey, Elisa wore many hats as a life partner, caregiver, and patient advocate. Ed passed away from HCC in 2022. And Elisa says she learned things she never wanted to know and misses him daily. And she's also served as a support mentor for I Merman Angels, and we have a partnership with them. We love them. But Elisa, I want to talk about that part of your bio that I'm so intrigued by. You learn things you never wanted to know. What did you learn that you never wanted to know? Because that resonates with me so much.
Certainly one of the things I learned about was encephalopathy, which when you learn about, when you're told about cancer from your doctor, no one ever mentioned that to us at the outset. And there were episodes, more than one, and it was both horrifying and heartbreaking to see somebody who is mentally sharp.
Yeah.
I mean, there were ascites,
Yeah.
episodes of ascites at one point.
Would you explain in layman's terms what that means, actually?
Basically, fluid in the belly, which needs to be drained. And we would go into the hospital for these drainings. It almost became comical in a way, because we knew the staff, they knew Ed, he
Yeah.
was very personable.
They knew you.
They knew me, they wanted to kick me out because they were afraid I would pass out. We used to bet on how many quarts or whatever, that
Mhm.
thing, how much would they take out of him? Was it going to be 6? Was it going to be 9? It was like ridiculous. When he had his first radiation treatment, it seemed to go very well. He walked out just fine. We had it in New York. We live in, let's say, a half hour outside of Manhattan. And by the time we got home, he was shivering
Oh,
with
no.
cold. And, so the whole body temperature, the body's ability to regulate its temperature was lost in that moment, and in several other times. Just trying to nourish him. Ed was the chef in our family, and known for his culinary knowledge. And suddenly I was cooking and he was criticizing, but
Oh,
also,
no.
well, that was his nature, in the kitchen. He didn't have appetite, and
Yeah.
he suddenly developed, like cravings or desires for foods that he never ate before, kind of.
Oh, interesting.
It was very weird. But, Orgain, the protein drinks to try and get him nourished adequately.
Yeah.
Everything became a challenge, bottom line.
I am so glad you brought up nourishment, because I feel like even though they're supposed to be part of what medicine likes to call that multidisciplinary team, if you are seen in a major cancer center, and like you said, you were so close to New York, so you had a lot of options. But for some reason, dietitians and nutritionists are kind of just left out. And I feel like until you say something as the advocate for the patient, or the patient speaks up, that person's not brought in. And they are absolutely critical. I mean, cancer in general is because of the treatment, can be very difficult on your digestive system. But if it's a GI cancer, especially liver cancer, put the treatment aside for a minute, the cancer itself causes all kinds and wreaks havoc with your GI and your appetite. And so I just never understand why a dietitian and nutritionist aren't brought in from day one.
We did see a dietitian, a nutritionist at the hospital. We were set up with somebody.
Oh, good.
And,
was it helpful?
when a person is 70 years old, they're not about to change their diet.
Good
Really.
point. Fair point.
Whether they have cancer or not. And one of the things that was kind of horrifying and interesting was we were steered away from sugar. There's kind of a lot of, I don't know, a lot of buzz around sugar and cancer. Ed did like sugar, but the sugar, the erythritol and all of the sugar substitutes, they kind of work the same way in the liver. So
Yeah.
it's not really a solution. But at one point, I remember going into the refrigerator, Ed wanted chocolate milk. And we
Mhm.
had like syrup, chocolate syrup. And he had made this chocolate milk and put it in the refrigerator to chill. And I think the glass was filled 3/4 with the syrup. I was, what? You can't drink this. You can't drink this. So, little things that in retrospect are like nothing are big things.
Yeah.
Everything is magnified. In terms of, what did I never want to know? You never want to know any of this,
Yeah.
basically. But, I remember I did have a support person through Immerman Angels, and
What
she's
was that like?
so valuable, so valuable, because she knew the experience. They try and set you up with a person who has the same type of, who cared for a person
Right.
with the same cancer. And I could talk about scanxiety, as I called it, the anxiety that just comes before a scan, or how you regard the AFP numbers, the alpha
Yeah.
fetoprotein numbers. Ed was anemic throughout a lot of his cancer, and dealing with that was very, very difficult. And just having somebody to discuss, kind of, even well, ask the doctor about this, that she would say, or
Right.
or it was great to have somebody who was informed and had the language to talk about it.
Yeah, and you mentioned earlier, I just want to comment, alpha fetoprotein is a protein that's often elevated in people who have liver cancer, but not everyone. And also you mentioned the ascites, which, like you said, is this fluid building up in the abdomen. And again, not everyone with liver cancer has ascites. But if you do, it's just like Elisa described, you have to go and periodically get it drained. And I've heard also just having that fluid buildup can be quite painful for
Yeah.
people. And again, it's liver cancer there are some commonalities, but there are some differences as well. I want to take you back to when he was diagnosed. How did you and Ed react to the diagnosis?
We were stunned, just absolutely stunned. And the we have grown kids with families of their own, and communicating it to them was also horrifying. Just,
How did you communicate it to them?
he told he actually had the conversation with his sons.
Oh,
I remember telling my brother, who immediately said to me, you need to take care of yourself. But it's interesting. Everybody has said that, and everybody has also said, but I didn't.
that's right. That's right. It's
So
really hard to do in the moment, right?
it's almost impossible. Uh,
Yeah.
uh,
Um, what about your work life situation? So
I
we heard
did.
from Angela, who was quite young. We heard from Betsy, who was retired. What about you and Ed as far as where you were in that part of your life?
Um, we were both working. Ed had 2 restaurants, uh,
Wow.
and uh, after he was diagnosed, he continued to go to work as much as possible, certainly in the early part of his diagnosis. I also continued to work, but with great flexibility. I worked remotely. I even went to the hospital carrying my computer. I remember when he had radiation and I took my computer down. The radiation was like subterranean.
Right. It always is.
No signal,
No signal.
no signal. But I managed to, I just, made myself work in large part because it helped me. Not even the financial aspect, but the focal point. It helped me maintain some normalcy. That's not to say I worked my regular hours or I was always available for my colleagues. I just did the best I could. And it did work.
Wow.
And for Ed, he, it was very tough. The restaurants are his babies. And
I was going to say, was there a time where he told his staff, because people working in restaurants tend to become like family?
yes, he told his partner, who is the same age, via phone. And then we had a big meeting, and all of that was very difficult. And the staff found out. We were, it was very tricky because you don't want to tell people at an eating establishment that you own that you're sick with
Yeah.
that's, your liver.
Yeah.
But actually, once we did, we had quite a bit of support from people who knew us and certainly who worked with him.
Oh, that's so good to hear. That's so wonderful to hear. You mentioned that you you had support through I Merman Angels. And I believe that we have a mutual friend in common, Sarah.
Yeah.
Sarah was also in our Caregivers Corner with Bonnie Pickard.
Yeah.
Sarah has also spoken at HCC Live, and Sarah now serves on the board of directors for Blue Fairy, as well as another nonprofit organization. And she's just so lovely. What other kind of support did you have? Because I'm really intrigued about one of your friends, but I don't want to give it away.
So so we have this very foodie community, good friends of Ed's, and one of them, who is kind of a notable cookbook writer, was making a change in her own career to becoming a death doula. And that's a person who basically you meet with, and like a birth doula, who's there to help you through the experience. She and her husband and two other friends of ours in particular would come out to our house. We would meet with them regularly and go to dinner or get together and eat and, socialize, and either at a restaurant for a while or they'd come to our home. And it was a tremendous benefit because it was normal, and the rest of everything was abnormal. It's just a relaxation. You can let the stress go. That's so incredibly helpful.
There's something to be said for normal, isn't it? Isn't there? Like,
huge. And there was a certain rhythm to it as well. They would see us once a month or so, whatever it was. There were also people who I spoke with, regularly, girlfriends or close friends of ours, or my kids, my colleague, my boss, who I've known for like 30 years. I remember one day I would run out of the house to, the store to get something. And that was my time to fall apart because I never
Oh,
wanted to do that
yeah.
in front of Ed, you know. So I would make, surreptitiously call a friend and say, I just have to talk to somebody. The other
Yeah.
thing that happened was he definitely became quieter. Um, and that was,
How did that impact your relationship, if you don't mind sharing?
it didn't impact our relationship. It didn't, but it made me sad.
Mm,
Here was somebody, my partner, you
yeah.
know, who we share everything and we talk about everything. And he just, I don't know if it's the brain that's changing, or I didn't know if he
Yeah.
was lost in his thoughts, if he was having thoughts that he didn't want to share with me. I just didn't know. And it was quite difficult. And there's not a lot to do about it.
Yeah.
So I found I needed to talk to other people. And I did have other people kind of calling me and saying, how are you doing? You know,
That's
or
so nice.
yeah,
That's wonderful. Do you think knowing Ed as well as you did, and he was your life partner, is it possible that he was trying to protect you?
it's entirely possible. I One doesn't know.
Yeah. Yeah. Even though she was only 15, my sister, and she was like my child, and because I raised her, but I know now in retrospect, I can look back at certain conversations and certain little things she said, and she was very much protecting me. There was a point in her journey where she knew she was dying, and I was delusional, and lived in a very healthy state of denial. It was the only way I could function. I thought she was getting better because we had just sailed through chemo like it was nothing, and that we had never had that. Plus, she wasn't in pain anymore. And I didn't know that that can often happen with a lot of different devastating illnesses, especially cancer. You can have this moment where you sort of just have this bump, if you will, where your body appears to be getting better. You're no longer in pain, and that can sometimes be a sign that you don't have much time left. So I know my sister very much protected me. I think you already answered this, but I think it's worth repeating again, and then we'll bring all the panelists back and answer your questions. Um, what advice would you give for other liver cancer support caregivers?
I would say definitely line up some good friends who you can call at
Mhm.
strange hours, like early in the morning. Like Ed did sleep much more. And so I would be kind of wandering around and not leaving the house, just as, like, I think it was Betsy who said she didn't want to leave her husband alone, and the same here.
Yeah,
Um, so, at 7 in the morning, sometimes I'd be up and wanting to talk to somebody desperately because I was just overwhelmed with everything that was happening to us.
yeah,
So a group of people, not the same person every time, not just your family, because you don't want to dump on your family either.
yeah, that's tough.
And sometimes you need to dump. You can be sometimes you need to wallow in the woe is me aspect. One of the things that my Immerman angel, Sarah, sent to me was like a little thing that you put in your yard that said something to the effect of, I didn't know how strong I was. And
Mm.
I remember seeing that and thinking, I don't want to be strong like this.
No, I feel you. Oh my gosh.
This is just,
Yeah.
it's so the whole thing was so left field. But we
Um,
did have some time together, which was great.
Allison, if you would please bring Angela and Betsy back to the stage, but I just want to follow up, Elisa. I had a friend who was coming to town. I hadn't seen a college friend, and she knew my sister was in the hospital. She was a mental health professional, so she knew cancer was not contagious, and she was bringing her 1-year-old daughter, and I really wanted to see her. And she called me up and said, I want to take you out to lunch. And I said, you know, my life's changed quite a bit. I said, we're in the hospital this weekend for chemo. And I said, Adrian would love to see you, because Adrian was there for this friend's wedding and knew her somewhat well. And I said, and we would love to see your, 1-year-old daughter, Sarah. Why don't you come by? These are visiting hours. We would love to see you, but I can't just pop out for lunch. And this friend said to me, well, Andrea, God only gives you what you can handle. And I said something and just got off the phone. I just could not say, I could not even respond, because my thinking immediately was, oh, okay, because I'm strong. My sister's incredibly strong. That's why this happened. And I know she didn't mean anything inappropriate by it, right? I know actually many years from now, down the line, I know that was her way of coping with the news. And it's no reflection on me, but man, it was the wrong thing to say. And the last thing I wanted to hear. I didn't want to hear how strong I was either. I didn't want to know that.
Yeah.
Ladies, I thank you so much for being so vulnerable and sharing your stories. And I'm so sorry for your loss. And we do have some questions, so let's dive into them. And again, if you're putting questions in the chat, please put them in the Q&A. And so we are going to start with Pat here. So click answer live. My dear friend had breast cancer about 5 years ago, and she was just diagnosed with liver cancer. I don't know much more specific than that. She's been prescribed anti-estrogen therapy and a chemo pill daily. I've shared all my nutrition information and information about the liver processing everything we eat and drink. It falls on deaf ears. I'm at a loss. So ladies, any one of you can take this. If this were you and this was your dear friend and you're trying to help out, what advice would you give to Pat in this situation? Again, any of you can take that. Go ahead, Lisa, please.
Since food was such a huge part of my journey,
Yeah.
I think that you really have to, particularly with liver cancer, or maybe any cancer, you really have to respect the patient's wishes, culinary, and all of that, because your friend knows, and they're going to eat what they want to eat, and you got to do the best you can, but you're not going to change them.
Angela, Betsy, anything to add to that question?
I was just going to say, if this is your good friend, you don't want to cause friction between you. So you get the information, they have the information, and you can only do what you can do. And you, as Elise said, you have to respect their wishes, and they know what they're up against. And you're not going to change anyone unless they want to make the change.
Amen to that. And all I'll add, Pat, was I had a little more power as a parent in my situation, but I could not get my sister to drink water, and until we discovered Powerade. And it was like, good, that's close enough. She loved Powerade. It had to be blue, and her favorite color. I don't think it had anything to do with the flavor. And that was my way of keeping her hydrated. But again, I was in a little bit of a different position as a parent versus a friend. And I absolutely agree with Betsy and Elisa. The person has to want to change. Pat, thank you so much for your question. Okay, this is from an anonymous attendee. Is depression, answering live, is depression and negative thinking common in liver cancer, and distorted thinking, such as he's not in his right mind evaluation? So again, any of you can take that, and let's split those up. Depression and negative thinking versus distorted thinking, which might be HE. So who would like to answer the depression and negative thinking? Anybody?
My husband, who is the most positive person in the world,
He is.
when there were days he was just depressed with all of this. And that was difficult for me because that wasn't his normal nature. But this disease is so difficult, and depression and negative thinking. Like one day he said, well, I'm never going to get a phone call, because as we were waiting on the list for transplant, it's never going to happen. And then the next day he was planning a trip. Oh, well, after my transplant, let's go to Aruba. So,
Oh my goodness, that's a
yeah,
seesaw.
I mean, yeah, that's what I mean. It was so up and down with the depression, and then sometimes positive, and just the negative thinking. I mean, he even wrote, he didn't think he would ever get a transplant. So he wrote letters to our children
Oh,
to be opened after he was gone. So, I mean, our outcome, fortunately, was much better than many.
and then not in his right mind part, which for this anonymous attendee could be HE. I mean, definitely. And anybody want to comment on that? If your loved one, if maybe the way I'm going to phrase it is there a way HE can be diagnosed sooner that you discovered in your journey? Go ahead,
Uh,
Lisa.
I know that every time we went to the hospital, worried about HE, they would ask certain questions, like about the date and who was the president, and kind of obvious things.
Yes. Yeah.
But in terms of the depression, so little obvious things, like there was one time here that he had gotten confused about why we were getting together with our kids. He thought it was Father's Day, it was a birthday instead, like that. But on depression, there was one point of depression, and in fact, the hospital set him up with a therapist who he would speak with. I have no
Wow.
idea what they talked about, but they did.
Wow. I'm glad you brought that up, because that's another person, that mental health provider that often is available but not mentioned by the cancer team. And next month our theme is unsung heroes, and we're going to be talking about mental health providers, dietitians and nutritionists, oncology nurses. I know, Angela, you mentioned for your husband it really helped his state of mind when your daughter FaceTimed him, right?
Yes. I couldn't always figure out where he was. He got kind of quiet or quieter. And of course, he was sleeping quite a bit. But I do feel like he wanted to know what was going on with her. So I showed pictures, and like I said, I tried to get her to FaceTime him some. So I think,
Oh,
yes, probably doing the things that would make them feel a little better. If you know they friend likes flowers, take some flowers.
yeah.
Write an encouraging card.
Yeah. Oh, thank you. And thank you for the anonymous attendee who submitted those questions. These next couple of questions, again, we're going to preface this that we are not healthcare professionals. We are not medical oncologists. So this is coming strictly from a caregiver perspective. This first one is from Elizabeth Mueller, and she is saying, I had a fibro scan and I don't want to wait until November to find out the results. How do I read the results of a FibroScan? We have not talked about FibroScan. Did any of your husbands have a FibroScan?
That's where they measure the fat in the liver.
And can you, Elisa, did you ever have issues getting the results of the FibroScan? No. Elizabeth, what I would say to you is, I don't know why you'd have to wait till November. Like that's 2 months from now. I would, I'm a big fan of the squeaky wheel, and I would, in a very nice way, because you can't offend them, hound the doctor to see the results. Also, oftentimes the results are in your electronic health record before the doctor ever calls you. They're often there in your EHR. So that's a possibility as well. I know many, many people that found out about a cancer diagnosis or test results from their electronic health record weeks before the doctor ever called them or had a follow-up appointment. So again, we're not medical providers, so I think that's the best you can do. Ladies, do you have anything to add about that?
You have to advocate for yourself. And like you said, not to be the squeaky wheel, but you do have to keep calling them.
Yeah. Yeah.
I agree with that 100%. I had my husband's nurse on speed dial because you really, if you don't advocate for yourself, then you sometimes get pushed to the bottom of the list.
Yeah.
And you know, if you're in there and telling them and talking to them, yes. And the fiber scan, from what I understand, and I'm not real sure, it doesn't take that long to read. Like I
shouldn't.
know when my husband had his fiber scan, well, they weren't looking for cancer because they already knew he had it. But when he had his fiber scan done, she was able to give him results right there in the room after she had done this fiber scan. So
And at least, Lisa, you were going to add to that?
I just wanted to say, you mentioned nurses, we're talking about advocacy. One of the things that repeatedly happened, there's a lot of waiting for, whatever.
There's a lot of hurry up and wait, right?
There's a lot of hurry up and wait. And, you're getting blood, you're getting iron. Ed got iron repeatedly and hydration and this and that and the next thing. And as the months went on, his veins, it became harder and harder to find a good vein. And so as a matter of course, when we would go into the clinic where they were going to do this, we would say, give us your best nurse, the one who is the best at finding the vein, because you don't want your loved one to be poked 5 times and they always have somebody. They always know who it is on their staff who is the best.
Yeah, I agree. My sister had a port put in during her biopsy, and which was very standard over 20 years ago. And one time we were going for a regular follow-up, where you spend that whole day in clinic, blood work, scans, the whole 9 yards. And this is at Children's Hospital Los Angeles, and a nurse came in, and my sister out of habit just would flip the port out of her bra, and she knew what was coming. And this nurse came in and said, "Yeah, I don't know how to use that." And I just looked at her and I said, "Well, find someone who does." Because it's like the whole point was not to poke her. And my sister was actually scared of needles, so she liked the port. Like she was like, "Yes, use the port." And they did. You're right. There was someone. Elizabeth, thank you so much for your question. We have another question from Elias Tucker. And again, I preface this, we're not medical professionals, but we're giving you our personal opinion. Should I have a hepatologist? I have so many questions. I am newly diagnosed. Elias, I'm really sorry to hear that. I have HCC and stage 4 cirrhosis. I had to ask about my cirrhosis because I had no idea that I had it. And Elias, I'm going to start as a patient advocate who's been in this space for 20 years. Yes, on the hepatologist, but also it does depend on where you live and how close you are to a university or medical hospital or an NCI center. But Elias, definitely, if you follow up with us with Blue Fairy, we will make sure that you are connected to a hepatologist and or get a second opinion. Not every person with HCC sees a hepatologist, but a lot of times that has more to do with geography than it does insurance, let's say. Ladies, what about you? Did your husband see a hepatologist?
my husband definitely saw a hepatologist, and in the support group that I run with people with liver disease, so many of them, like their doctors don't want to recommend a hepatologist. And like you said, the geography, the more rural areas,
It's tough.
some of them had to drive a 2-hour wait to see a hepatologist. So some of them are going to gastrologists,
Yes,
And
that's true.
you're okay, but if Elias said he had cirrhosis and HCC,
Yeah.
I would definitely, if at all possible, if I were he, I would definitely try to find a hepatologist.
And Elias, Allison, if you could please put a link to our support group again for HCC patients and caregivers. Elias, you can post in that support group, and you can even join anonymously or make up a fake name. But it's HIPAA compliant, and again, we'll get you connected. Elisa, I saw you nodding your head. Your husband had a hepatologist?
Yes, but Ed was diagnosed in July 2019, and when we needed our hepatologist most, he was down for the count with COVID.
Oh,
And
no. Oh,
yeah,
really?
and so we were dealing with his like nurse practitioner, trying to get a handle on his anemia.
Mm.
We couldn't figure out the source of the anemia. So the hepatologist, he had a hepatologist, but when push came, when everything, when he was once he was diagnosed, almost the guy basically was out of the picture because of COVID.
Wow. Wow. Okay, so again, Elias, thank you so much. And my sister didn't see a hepatologist until I transferred her care to UCLA from Children's Hospital Los Angeles, which was crazy. But then she did have a hepatologist. So we are enabling closed caption for the webinar. Again, thank you so much, Elias. Esquel Ezekiel, I'm not saying this right. I'm so sorry. It says, please turn up the volume on Zoom. I can hear all these amazing ladies really well. All I can say is turn up the volume on your end. There's not much we can really do on our end for you. So apologies for that. We have one more question, and this is from Elizabeth again. And she says, I take a lot of naps. I have my entire life. Is my fatigue still a sign of liver issues? And Elizabeth, I would just say, again, we're not healthcare professionals. If you could provide more information, like do you have underlying liver disease? If you could provide that information, I think that would be helpful for our panel here. Because I think fatigue is challenging because it's a sign of a lot of things. And then I'm going to say something and then let the ladies answer. My sister was as far from the typical patient as you could get at that time in 2001. And the only obvious symptom she had was, which I think I already mentioned, was acid reflux. She wasn't tired. She was a very active 15-year-old. And so the only other thing that was off, if you will, which is not a sign of liver cancer, but was a sign of something being wrong in her body, was she had stopped getting her period. And TMI in my family, we women, we can, it's like clockwork, right? And she was 15, had a serious boyfriend. I thought she was pregnant. I was panicking as a parent. And she assured me that was not the case. And so again, not a sign of liver cancer, but it was a sign of something being wrong in her body. Elizabeth, thank you. Okay, so Elizabeth added, I have NASH. Okay, so Elizabeth's taking a lot of naps. She has NASH. She's got fatigue. Ladies, what would you say to Elizabeth?
Well, my husband had NASH as well. And that was the first sign, was the fatigue. And
Okay.
sometimes, like he was like a young baby, he would have his nights and days mixed up. He would be up all night, dozing on and off watching television, and then sleep all day. So yes, and like I said, I've talked to a lot of patients, and they do believe, the tiredness, and people don't understand how tired you can get. In the morning, yes, you might be able to do something in the morning, but that means you can't do anything in the evening. And what one of the people we talked to said, think of it as spoons. You have so many spoons per day. So if you use your spoons in the morning, if you say you have 4 spoons for the day, but you used 3 spoons in the morning because you had a doctor's appointment, you had to go grocery shopping or something else, then you only have 1 spoon for later on in the evening, and that might not be enough. So a lot of people that I know think of it as the spoon theory, and there is something somewhere online about spoon theory, but I just like to say most people do not realize that how tired a person can get. They don't understand, and that seems to be a big complaint among many of the patients that I know.
Angela, your husband, I know the actual diagnosis and journey was short, but he had been living with liver disease. Was he having any fatigue?
I don't think anything unusual. You know, he was active in yard work and doing stuff with the kids, but I don't think it was anything unusual.
Okay. Elizabeth says, thank you. She likes the spoon theory idea. Elisa, what about you? Did Ed, I believe, have any signs of fatigue?
I don't recollect any signs of fatigue particularly.
No.
He sometimes took naps, but basically Ed was a man of tremendous energy.
Oh. So Elizabeth, I hope that helps. And I'm going to double check the chat. We have 4 minutes left. So if we have any other questions, now is the time to get them in. And again, Allison, I see you posted a link to the community. If you could post that link, Allison, again, make sure it's just the clean link, not the full sort of Google link there in our community. And I want to, first of all, I want to thank all of you ladies. I want to thank Elisa and Angela and Betsy for sharing your stories. And I think that all 3 of you show sort of the commonalities and overlap, but also just the differences, right? All 3 of you are located in different parts of the country. Your husbands had different experiences. And so I really appreciate you sharing. We have 3 minutes left, and this is going to live on our YouTube channel, and we're going to be promoting the replay. Is there one thing that you wish you had known at the very beginning, you wish someone had said to you? Is there one thing, I know I'm kind of putting you on the spot with this question, that you would like to tell the audience out there?
Be with the person. You don't really know the length of time.
Thank you, Angela. Elisa or Betsy?
I will say that my brother told me, and I believe this, that it is a privilege to be with your loved one while they are ill. It's horrifying, but it's also such an intimate time, and it can be very rewarding in its very weird way.
Betsy, anything you wish someone had said at the beginning?
Never give up hope. Hope is always alive. And just because you have this diagnosis, and of course, my situation was a very happy ending, but you know, never give up hope. And just because you have this disease does not mean that it's a death sentence for everyone. And you certainly just keep the hope alive and be as positive as you can.
And I just want to add to what Betsy said. Tony is alive and well. He had a liver transplant. So I do recommend, I think it was Elizabeth. I definitely recommend you watch our liver transplant workshop. Because my first thought when you told us a little bit more about your fatigue and NASH my first thought was, are you eligible for a liver transplant? Like that was my immediately thought, because it is one of the very few curative measures for HCC. So I want to thank all of our panelists and ladies. I don't know when I hit stop record if it's going to stop the actual webinar or if it's going to end everything and say goodbye. So, but I do want to end on time. So thank you so much if you watched live. Thank you for watching the replay. And if you want to get in touch with any of these ladies, please reach out to our program manager, Allison. and we will connect you as long as they are willing, because we're not going to give out their personal information. But thank you again. I'm going to stop what I believe is the webinar, but hopefully I will still see you ladies.
Bye. Thank you.